Hello everyone. Today we are diving deep into a topic that is fundamental for any medical student, otolaryngology resident or anyone preparing for anatomy exams, the clinical anatomy of the ear. We'll cover everything from the auricle you can see all the way to the inner ear structures responsible for hearing and balance. So let's get started. We begin with the external ear, which consists of two main parts, the visible auricle and the external auditory canal. First, the auricle, it's not just a flap of skin, it's a complex piece of cartilage with distinct landmarks that are important for surgical incisions and reconstructions. We have the outer rim, the helix, which starts here at the crus of the helix. Moving inwards, we have the antihelix, which splits to form the triangular fossa above. You can see all these features in the picture given on the right side of the slide. Anteriorly, you have the tragus and opposite it the antitragus. Below all this sits the soft fleshy lobule. And finally, the deep central depression leading into the canal is the concha. Next is the external auditory canal or ear canal. In adults, it's about 2.5 centimeters long and it has a unique S shape. But more importantly, its structure changes along its length. The outer one-third is cartilaginous. This is clinically significant. The skin here is thick and contains hair follicles as well as sebaceous glands and specialized ceruminous glands that produce earwax or cerumen. Now, why is wax important? It's not just dirt. It's hydrophobic, acidic and has antibacterial properties. It's a natural defense mechanism. Also, the skin of the entire canal has a remarkable capacity to migrate. It grows outwards, carrying debris and old wax with it, a natural self-cleaning mechanism. The inner two-thirds is bony. The skin here is very thin and tightly adherent to the periosteum. This is why even minor swelling from something like a boil in this area can be excruciatingly painful, as there is no room for expansion. At the end of the canal lies the tympanic membrane or eardrum. It's attached to the temporal bone by a fibrous ring called the annulus fibrosus. The membrane itself is divided into two key parts. Most of it is the pars tensa, which consists of three layers: skin, fibrous tissue and mucosa, coming from the ectoderm, mesoderm and endoderm respectively. The smaller upper part is the pars flaccida. This area lacks the middle fibrous layer, making it more flaccid and importantly a common site for retraction pockets in chronic ear disease. When you look at a normal eardrum through an otoscope, you can see several crucial landmarks. You can see the handle of the malleus and its lateral process. Radiating from the lateral process are the anterior and posterior malleolar folds. And of course the well-known cone of light or light reflex, which is the reflection of your otoscope light from the antero-inferior quadrant. Let's quickly cover the neurovasculature of the external ear. The nerve supply is fascinatingly complex, coming from multiple cranial and cervical nerves. We have the auriculotemporal nerve, which is the branch of trigeminal, the greater auricular, which comes from cervical 2 and 3, and a small branch from the facial nerve. Most importantly, a branch of the vagus nerve called Arnold's nerve supplies part of the canal. This explains why some people cough when you clean their ears. It's the Arnold reflex. Blood supply comes from branches of the external carotid artery with venous drainage following the posterior auricular and superficial temporal veins. Lymphatic drainage is to the preauricular, infraauricular and mastoid lymph nodes, which are often checked in cases of infection or malignancy. Now we move into the middle ear. It's not just a single space, it's a system called the middle ear cleft, which includes three main parts. The middle ear proper, which is the main air-filled box, the adductus, which leads back to the mastoid antrum and the mastoid ear cells, and the Eustachian tube running forward to the nasopharynx, with its upper one-third being bony and the lower two-thirds cartilaginous. The middle ear proper is essentially a 6-walled box. Let's go through each wall clinically. The lateral wall is mostly the tympanic membrane we just looked at. The medial wall is the entrance to the inner ear. Here you find the promontory, which is the bulge of the cochlea's first turn. Above and behind it are the oval window and the round window, and you can often see the bulge of the lateral semicircular canal. The anterior wall contains the opening of the Eustachian tube and the canal for the tensor tympani muscle. The posterior wall features the otitis leading to the mastoid and the pyramid, a small bony projection. The superior wall or roof is a thin plate of bone called the tegmen tympani, separating the ear from the dura of the middle cranial fossa. The inferior wall or floor is another thin plate of bone separating the ear from the jugular bulb. You can see the schematic diagram of the 6 walls of the medial cavity in the diagram shown. So what are the contents of this space? First, the ossicles, the malleus attached to the eardrum, the incus and the stapes, which sits in the oval window. They form a delicate chain to transmit sound vibrations. Second, there are 2 tiny muscles, the tensor tympani supplied by the trigeminal nerve and the stapedius, the smallest skeletal muscle in the body, supplied by the facial nerve. Their job is to dampen loud sounds. And third, a crucial nerve, the chorda tympani, a branch of the facial nerve which runs across the eardrum, carrying taste from the anterior 2/3 of the tongue and the parasympathetic fibers to the salivary glands. The sensory nerve supply of the middle ear lining is unique, coming from the Jacobson's nerve, a branch of the glossopharyngeal nerve. This is why an ear infection can sometimes cause referred pain in the throat and vice versa. Arterial supply is rich from branches of both the external and internal carotid arteries. Venous drainage is to the pterygoid plexus or the superior petrosal sinus, and lymph from the Eustachian tube drains to the retropharyngeal lymph nodes. Finally, we arrive at the inner ear, the most intricate part, embedded deep in the petrous part of the temporal bone. It's divided into 2 main labyrinths. First, the bony labyrinth, a series of cavities filled with a fluid called perilymph. It comprises 3 parts: the vestibule, which houses the utricle and saccule, the 3 semicircular canals, and the cochlea, a snail shell-like structure with 2.5 turns. Inside this body casing floats the membranous labyrinth filled with a different fluid called endolymph. This is the functional unit of the inner ear. It consists of the membranous semicircular canals, which contains the crista and cupula, the sensors for rotational movement, the utricle and saccule containing the macula and otolithic membrane, the sensors for linear acceleration and gravity, the cochlear duct, which is triangular in cross section and contains the organ of quarti, the actual organ of hearing, and finally the Y-shaped endolymphatic duct in sac, which drains into the cranial cavity and is clinically significant in conditions like Meniere's disease. The blood supply to this vital structure is primarily the internal auditory artery, which is usually a branch of the anterior inferior cerebellar artery. It's an end artery, meaning a blockage here can have devastating consequences for hearing and balance. To wrap up our anatomy tour, we have to look at the 2 nerves associated with the inner ear. The vestibulocochlear nerve is the nerve of hearing and balance. It has 2 divisions, the cochlear division and the vestibular division, which further splits into superior and inferior branches. And right next to it, traveling through the same internal auditory meatus and then through the middle ear, is the facial nerve. Its close relationship to the middle and inner ear explains why infections, tumors or trauma in this region can sometimes cause facial paralysis. And there we have it, a comprehensive overview of the clinical anatomy of the ear from the auricle to the inner ear. We have covered the structure of the ear canal, the landmarks of the eardrum and 6 walls of the middle ear, and the delicate labyrinths of the inner ear. This knowledge is the foundation for understanding hearing loss, balance disorders, ear infections and the surgical approaches to this fascinating region. If you found this helpful, please hit that like button. Subscribe to the channel for more high-yield anatomy content and let us know in the comments what topic you'd like us to cover next. Thanks for watching and I'll see you in the next video.